ITAC in Adelaide for the conference for 2018, and we've got Jeff and Duncan here from Vital Care. Look, you've been in the industry a long time. You're doing some really innovative things. We're talking about the infrared capabilities. Tell us about some of your products.
Okay, so in the infrared area we use what we call an IRMA, an infrared movement alarm. That helps us to tell when a patient or a resident is in and out of bed. It also minimises the trip hazard of using the alternative, which is a floor mat or a bed mat, and far more efficient long term. So the mats are very expensive. The infrared movement alarm pays for itself typically in about 12 months.
But you talked about the exception, and I really like that. Can you explain that a little bit?
Yeah, sure. So we like to actually alarm or manage the care by exception rather than event. So rather than having a button pushed or an alarm go off every time something happens, what we like to do is build up a pattern of behaviour for our residents and our patients, and based on an exception to what is a normal course of events, then we alarm. So the exception is what sets off the alarm. This reduces the amount of alarm fatigue that a lot of carers suffer from, where they hear the alarm 250, 300 times a day and they get very tired of it. We can cut that down by over 50% by using this exception reporting based.
Fantastic. And Duncan, I'd like to involve you too. Tell us about, obviously there's so many changes going on in the industry. How are you keeping abreast of it all?
Well, what we do, we look at the core technology that's out there and try and find innovative ways that can be applied to the aged care industry, which largely hasn't changed much technologically in 30 years. So we're experimenting with things like accelerometers for movement, to analyse gait, to work out when people might fall rather than when they do fall. We're using technologies like LiDAR to monitor where people are, where the residents are in their room, to detect maybe where they've fallen, and technologies like that.
Yeah, that's fabulous. So, I mean, I had an experience with my mother that she actually did fall out of bed, and she was battered and bruised, and obviously the facility didn't have what you supply, so that was a real shame. But thank you so much to both of you.